We are here today because tomorrow all 4 regions of the Restore Illinois plan are eligible to move forward into the revitalization phase, or phase 4 of our Restore Illinois plan. With me today are 2 familiar faces to viewers of our COVID-19 briefings, IDPH Director Dr. Ngozi Ezike, who you've seen many times, and the University of Chicago's Executive Medical Director for Infection Prevention and Control, Dr. Emily Landon, whose advice, frankly, I have sought often, and she's been very generous with that advice, and I thank her for that. Also joining me are Carlos Nelson, the Chief Executive Officer of the Greater Auburn Gresham Development Corporation, who has made a career out of delivering meaningful community and economic development to our residents. The doctors and public health experts have reviewed the data and the proposed conditions for greater public activity and work conditions and have approved them, including the following activities with COVID-related health and safety guidelines. Health and fitness centers will reopen. Indoor dining at restaurants and bars will resume. Movie theaters, museums, and zoos will restore operations, and childcare and schools will reopen and expand, all in accordance with IDPH safety and health guidance. Starting tomorrow, hundreds of thousands more Illinoisans will be able to return to work. Moving to phase 4 this early was never a given. I've said since the beginning that data and science would design our path forward. And if any single region of the state were trending in the wrong direction in case positivity, hospitalization rates, or hospital capacity, we could not in good conscience offer that region the go-ahead to phase 4. We've seen what's happened in other states that have allowed politics or short-term thinking to drive decision-making. Many other states are now seeing significant increases in cases, hospitalizations, and intensive care bed usage, and they're being forced to move backward and stay at home. That's not the story in Illinois. Here, we have been gradually restoring business and leisure activities in a highly deliberate manner, guided by doctors' advice. And Illinoisans are following the mitigations that we can each do ourselves, like wearing face coverings, keeping 6 feet distance between us, and washing our hands frequently. As a result, we have significantly reduced our positivity rate, our hospitalizations, and ICU bed use, and we've seen dramatic declines in COVID-19 deaths. This is not to suggest in any way that our battle is over. But so much progress has been made, and if we continue to follow the path the doctors recommend, we can continue our march forward toward more normalcy. It's because of the people of Illinois that we're seeing a trajectory of success where other parts of the country are not. And I want to take a moment to tell you a little bit about that trajectory and remind you of where we've come from. Statewide, our COVID-related deaths per day are down 65% from a high 6 weeks ago. Even as our testing continues to grow, our COVID cases are down 76% from the trend's height 7 weeks ago. From a peak in the first week of May, the number of COVID-positive hospitalizations, including in the ICU, has dropped by over 60%. And we've seen a 67% decrease in ventilator use since reaching a high in mid-April. As we reopen so many businesses and activities in each phase, it's been important to watch the metrics closely to see if all the added activity would cause a spike in our numbers. That's what we did through phase 3. And the positive trends have continued while thousands of our small businesses in every part of the state have opened their doors again safely, as did our state parks, kids' day camps, and kids' summer programs. That's in large part because people have been wearing their face coverings in public and following other advice from doctors and scientists. I feel a solemn obligation to emphasize that we expect the journey ahead to be difficult. As more aspects of the economy open and more person-to-person interactions take place, there are many more opportunities for the spread of COVID-19. The virus hasn't gone away, and when people aren't wearing face coverings, gathering in large groups, and not practicing physical distancing, they're getting sick, and some are dying. And I mean people of all ages. Senior citizens, those who are in their 40s and 50s and 60s with pre-existing conditions, and yes, even young and perfectly healthy people have lost their lives to this terrible new disease that we still know so little about. That's why I'm not afraid to protect the people of Illinois by moving a region back to an earlier phase if we see a surge. Ours will not be one of the states that takes no action in response to a return to the peak. Until we have a vaccine or effective treatment, our core pillars for safely moving forward remain the same: widely available testing, extensive contact tracing, and widespread use of face coverings and social mitigations by everyday Illinoisans throughout the state. On testing, today we hit an important new milestone by surpassing 30,000 tests in a single day for the very first time. Continuing to grow our daily testing in this next phase has required a newly aggressive approach, one that makes our state a national leader in flexible testing to meet the demands of a more open economy. We're in the process of launching 12 mobile community testing teams that can be moved anywhere in the state to mitigate and suppress emerging outbreaks, including places like meatpacking plants, nursing homes, or other traceable gatherings. These mobile teams operate in partnership with a network of commercial labs that we've contracted with on a regional basis, allowing the delivery of results on an expedited basis. On contact tracing, we continue to build up our capabilities, including new hires that have increased the ranks of contact tracers already by 20% since June 1st, for a total of 550 active contact tracers so far across the state. 250 additional new tracers have been identified and will join their ranks over the next few weeks as we continue to scale up our operations, including new technology to multiply those new tracers' effectiveness. All 97 of Illinois' local health departments are participating and have applied for funding supported in total by $230 million for an increase in contact tracing. That money is on its way out the door, with final disbursement coming in the next few weeks. And because it's critical that we reach all our residents through every means possible, next month, community-based organizations will have the opportunity to obtain funding through IDPH to collaborate on contact tracing efforts alongside our public health departments. Of course, most important to our ability to minimize outbreaks is the efforts of everyday people to do their part. And to date, Illinoisans have reduced the rate of spread in their communities extensively. That's why we've seen the trends that we have and that have cautiously moved us through the Restore Illinois plan. As we move forward, it's critical that everyone continues to operate with those same mitigations. That means maintaining 6 feet of physical distance, washing our hands regularly, and crucially, wearing a face covering when in public places. Illinois required face coverings in public at the same moment that we began to slowly open more things up on May 1st. Since we implemented that one change, we saw all the numbers stabilize and then begin to fall. And in just the last week, we've seen other states like California and Washington following our lead in requiring face coverings. As we enter this new phase, we will be looking to adjust our plan over time as the data and science allows. If we see stable numbers over the coming weeks, we can then consider additional modifications to the framework of Phase 4. The goal here is to move ever closer to a restoration of activities and business that can be done in a safe and healthy fashion. The philosophy that got us here has been a successful one. Prioritizing public health and watching the virus rate of spread, our case numbers and positivity numbers, our hospital capacity. But any pride in our success has to be tempered by grief. Over just a few months, we have lost over 6,800 of our fellow Illinoisans to this virus. Today, we lost 41 more. May their memories be for a blessing. Many of our residents have lost someone that they love, a family member or a friend, to this virus. I know I have. This pandemic has brought real tragic pain to the lives of countless residents, and amidst renewed calls for racial justice, has disproportionately taken Black lives and caused disproportionate economic disruption in the Black community. As we take our next steps forward, and especially as we begin to safely reopen meaningful swaths of our economy, we have to continue to look out for one another. Our number one priority must be the health and safety of workers, families, and all of our state's residents. Illinoisans have demonstrated their commitment to that priority in countless ways. Let me highlight just one. Today, the Illinois COVID-19 Response Fund released its fourth and largest round of funding so far, nearly $7 million to over 40 nonprofit organizations all across Illinois, bringing its total impact to over $23 million so far, that has reached over 800 organizations statewide. This incredible effort is made possible by the more than 3,100 donors willing to give to their neighbors in these trying times, and by the vast network of nonprofits and volunteers who are on the ground serving families and helping them stay on their feet. This pandemic has brought so much hardship to so many, but through it all, the people of Illinois prove themselves to be the kindest and most generous in the nation. Thank you, and now I'd like to turn it over to IDPH Director Dr. Ngozi Ezike with today's medical update. Doctor.
So you did it. Illinois is being touted across the country of getting it right. If you weren't originally sure that staying at home and masking and physical distancing and washing your hands helps slow disease transmission, hopefully you're a believer now. We have seen declining fatality totals week after week for 5+ weeks, along with our declining numbers of admissions to the hospitals. And you did it with those 3 W's: washing your hands, wearing your face covering, and watching your distance. Should have worn my cheerleading outfit to celebrate and cheer, but now I want to tell you that there still is a reality check behind that. The virus has not been eradicated. The virus persists, and we don't yet have a vaccine or a highly effective treatment that's widely available. So although we are seeing fewer and fewer cases, fewer deaths, people are still being infected and people are still losing their lives. But as the numbers say, since yesterday, we did report 894 people who were newly diagnosed with COVID-19, which brought our statewide total to 139,434 cases. And as the governor reported, that included 41 additional fatalities, for a total of 6,810 lives lost from Illinois. As of last night, 1,626 people are in the hospital with COVID-19 illness. Of those, 399 patients are in the ICU and 216 are on ventilators. An important part of the goal is to increase testing capacity throughout the state. To date, well over 1 million tests have been run, with, again, as the governor mentioned, 31,686 being reported in the last 24 hours, are an important milestone of crossing 30,000. We are trying to get back to our normal lives. We are going to coexist with COVID. There's a deal, a social contract, if you will. Government officials, including public health leaders, we have the responsibility to gather the best available data and the best available science and share that information with everyone. And in turn, the public's part is to follow those recommendations, which will help keep individuals and entire communities safe. To help the public make these informed choices, we are launching a special new tool on the IDPH website that shows people if their county is staying on track. Our incredible IDPH team, along with amazing collaboration from our local health departments, have created a map that shows each county in the state and whether it's meeting target indicators or if there's a reason for some caution. Those indicators include the number of new cases over the last week, test positivity, emergency department visits, and hospital admissions for COVID-like illness. As well, we're looking at the number of deaths and the percent of ICU beds available in the area. The percentage of cases that are part of a cluster and the amount of testing that's been done in your county are also taken into consideration. All of these indicators will be on the website. I think they're up now, and the map will easily show you the status of your county and any other county you're interested in. If your county is colored blue, we're on the right track. If your county is colored orange, that's a caution or a warning that something is going on. And our goal is that with that caution, you will think twice about your own personal habits and activities. Maybe you'll think about reconsidering going out in that large group gathering. Maybe you'll reconsider going to an indoor dining experience. Maybe you'll consider appreciating a religious gathering online as opposed to in person. These county-level risk indicators do not necessarily mean that a county moves back. What it means is that if the numbers don't improve, we could be headed in the wrong direction. But of course, as you have seen, individual actions are so powerful, and so that is your signal to take action. As we open a lot of our state, the motto is to start low and go slow. Yes, we are all excited to open, but we're opening with limited capacity. We want to be able to measure the effects and then increase capacity as the data tells us that, yeah, we're good. We have gone so far along this right path, so I'm imploring everyone to continue with us in a deliberate manner. We've seen individuals contract the virus after attending wedding celebrations, church gatherings. We've also seen hair salons with what turned out to be infected stylists, but with everyone masked and covered, no customers were reported to get infected. The power still remains in all of our hands. I know it's summertime and it's a time to travel and to congregate. We want to chillax. We're coming up on an important holiday, our 4th of July, a day traditionally marked by picnics and parades and other patriotic events. Just a word of caution. Large crowds, of course, do increase your risk of exposure to the virus. It's still a risky endeavor. If you say, well, Dr. Ezike, you said that we slowed transmission and there are fewer and fewer infections. It should be safer now. I would say, yes, you're right. But because the virus is still out there, we still have to remember the things that got us to this good situation so that we can continue to safely coexist with COVID. Maybe we need to get cozy with COVID because it looks like this virus might not be leaving us anytime soon. So let's continue to do the things that will help us mitigate the risk. At the risk of sounding like a broken record, please continue to follow the 3 W's. Wash your hands, wear a face covering, watch your distance. We all know that that means at least 6 feet between you and the next person. And as part of this social contract, if you have any symptoms of illness, if you have a fever, shortness of breath, please don't go out in public. Please don't dine in a public place. Please don't gather with your friends. Let's take care of our fellow Illinoisans. Let's be respectful of each other. Please stay home if you're sick at all. Remember, we can still spread the virus before we even know we're infected. I can't ignore those voicing opposition to face coverings. You are still part of this contract too. I have to talk specifically to you. Your individual actions or even your inactions will still affect everyone in this state. I'm likening the refusal to wear face coverings to a game of Russian roulette, as we don't know who's infected, we don't know if we are infected, we're just taking a chance. This game of Ruskaya Ruletka is a game that is very risky. The stakes are high. It's potentially fatal. Let's not gamble with coronavirus. We don't even know the long-term effects of having COVID-19. What might happen to our lungs 5, 10, 20 years from now after being infected? There's nobody that can answer that question right now. So if we can prevent catching this dangerous virus, we should try our best to do so. The thing that has made the difference now and the thing that will continue to make the difference is you and your behavior. So please, let's continue to use our common sense. Let's be safe. Let's use the 3 W's to protect ourselves and our entire communities. Thank you so much for joining in this important effort. And now a summary in Spanish. Todos ustedes lo hicieron. Estamos siendo aplaudidos en todo el país como el Estado que lo hizo de la manera correcta. Y lo ganamos. Si no estaban seguros, el orden de quedarse en casa ayudó a atrasar la propagación de esta enfermedad. Me imagino que están convencidos ahora. Hemos visto una disminución en el total de muertes semana tras semana durante las últimas 5 semanas, junto con una disminución en el número de gente en los hospitales. Y lo hicieron por lavando sus manos, poniendo una cubrecara y vigilando su distancia física. El virus no se ha eliminado por completo. El virus persiste en Illinois. Todavía no tenemos una vacuna y no tenemos un tratamiento efectivo ampliamente disponible. Todavía existe la posibilidad de infectarse y luego transmitir el virus a otros. Aunque estamos viendo muchos menos casos y muertes, todavía hay gente que siguen infectados y muriendo. Desde ayer estamos reportando 894 personas recién diagnosticadas con COVID-19 para un total de 139,434 casos. También hay 41 muertes adicionales para un total de 6,810 vidas perdidas. A partir de la noche anterior, se informó que 1,626 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 399 pacientes estaban en la unidad de cuidados intensivos y 216 pacientes estaban en ventiladores. Estamos trabajando para aumentar la capacidad de prueba en todo el estado. En las últimas 24 horas se reporta 31,686 pruebas fueron hechas. Eso es la primera vez que han tenido más de 30,000 pruebas. Amigos, nuestro contrato social sigue. Los oficiales del gobierno, incluyendo los líderes de salud pública, tienen la responsabilidad de juntar los mejores datos y ciencia disponibles y compartir esa información en tus manos. Y la parte del público es seguir esas recomendaciones que nos mantendrán más seguras a nosotros mismos y a nuestras comunidades. Para ayudar al público a tomar decisiones informadas, estamos lanzando una nueva mapa en el sitio web de IDPH que muestra cada condado para ver si está cumpliendo con los objetivos. Esos indicadores incluyen el número de casos nuevos, la positividad de pruebas, las visitas al departamento de emergencias y la gente en el hospital por enfermedades similares a COVID-19. También el número de muertes y el porcentaje de camas disponibles en la unidad de cuidados intensivos en el área. el porcentaje de casos que forman parte de un grupo y la cantidad de pruebas también se tienen en cuenta. Todos esos indicadores estarán en el sitio web, pero el mapa le mostrará fácilmente el estado de su condado. Si su condado está de color azul, están en el camino correcto. Si su condado está de color naranja, eso es una señal de que posiblemente hay más riesgo de infección. Y debe pensar 2 veces antes de salir en un grupo más grande, o tal vez esperar para salir a cenar o al cine. Estos nuevos sistemas son señales para alerta a los condados informando que deben tomar medidas. Mi consigna es comenzar bajo y ir lento. Hay que abrir despacio, medir los efectos y luego aumentar si los datos dicen que vamos bien. Hemos ido tan lejos por el camino correcto, así que te ruego que continúes. Es verano, por lo general un tiempo para viajar y juntarnos. Casi llega el 4 de julio, un día tradicionalmente marcado por desfiles, parrilladas y otros eventos patrióticos. Palabras de precaución. Las grandes reuniones siguen siendo un esfuerzo arriesgado. Recuerda que vamos a coexistir con COVID-19 hasta que haya una vacuna contra este virus o una medicina efectiva. Por eso tenemos que seguir adelante con mucho cuidado. Por favor, siguen lavando sus manos, poniendo sus cubrebocas y cuida tu distancia cuando estás afuera. Muchísimas gracias. And with that, I would like to turn it over to Dr. Emily Landon, a hospital epidemiologist.
Good afternoon, everyone. And thank you, Governor and team, for inviting me to be here with you today. The first time I spoke from this podium, it was to ask the people of Illinois to make huge sacrifices in order to protect our neighbors and families. Since then, all of us have canceled plans and watched opportunities, traditions, and celebrations just slip away. We've lost a lot of precious time with our families and our friends. Many have lost livelihoods, and many have lost much-needed income. And 6,982 people in Illinois have lost their lives to COVID since I last stood here. But that number would have been thousands and thousands higher if we hadn't been willing and able to join together and stay home to stay safe. Today, we cautiously celebrate our progress and our success by taking more steps out into the new normal, coexisting with COVID. It still spreads like a ghost between people who seem to be healthy before making its presence known. Then it targets the vulnerable, the elderly. And make no mistake, the risk may be lower for some, but too many young and healthy people have succumbed to COVID-19. And there will be more deaths to come. Staying home was an important tool to fight a raging firestorm of infection. And there will still be embers and even brush fires that could force us to pull back to an earlier phase or turn a county orange on the new website. But what we must avoid is a conflagration that sends us back to our homes and threatens our healthcare system and our economy. We have to learn to extinguish these small sparks by starving them of the fuel that they need in order to spread. We do this by wearing masks, by keeping our distance, washing our hands, staying home when we're sick, getting tested when we need to be, and engaging with and following the advice of the contact tracers when they call. None of these interventions is perfect or meant to be perfect on their own. And some are impractical in certain circumstances, but layered together, they knit together to make a safety net that lets us go and get our hair cut, or
first of all, before I get started, I know Dr. Williams is going to be out here a little bit to talk about the testing. I think that just got released earlier today. I think there was around 14,000 tests that were backlogged through Quest, I believe. Of that 14,106, I think around 160 some odd was positive, but I'll let Dr. Williams give you the exact numbers on that. But I think it's just important to know that that was a backlog of about 3 days that come in. So the good news is 13,000 of that was negative, over 13,000 was negative, and 163 positive in that batch. But I'll let him talk about that when he comes up here shortly. Today I had a chance to talk with the Missouri Chamber of Commerce on a Zoom call, as well as several Kansas City area chambers today, and it was kind of good to be out to talk about the economy again, to talk about workforce development, to talk about where we're headed in the state of Missouri, and some positive things that were going on, and what we had done on the COVID-19, and how we were how we were moving forward on COVID-19 to move the businesses forward in the state of Missouri. So I think everybody was upbeat. Trying to find ways that we get people back into the economy, get the businesses back open, and getting back to some sort of a normal lifestyle as much as possible. We did have our opportunity to talk about some businesses that were opened in the Kansas City region. Of course, we was up there about a week ago to Burns and McDonald up there. The expansion they had up there was an extremely large expansion up there. This week, Accenture in St. Louis, 1,500 or 1,400 new jobs up there. Couple of more companies we're going to be able to announce, I think, in the very near future that's maybe going to be moving back to Missouri. So a lot of good things are happening in the state. We just got to stay focused, realizing, as I say again, we have to do both, keep going with the economy, open up the economy, keep building our business platforms in this state, focusing on infrastructure and workforce development, at the same time deal with the virus and make sure that we're doing everything we can to keep the people to stay safe and to move forward as school season's not too far away to start preparing for that. So a lot of things going on in the state right now, and Missouri continues to move forward. And the new school year is right around the corner. And it seems from where we started in January, and we wasn't even thinking about school. Now here we are thinking about opening the schools again, the universities, getting the kids back into the rhythm of education, which we got to get them back in there and get that done. So we're looking forward to that happen. And I know there's a lot of questions about what school is going to look like this fall. And the Missouri Department of Elementary and Secondary Education has been working to develop guidance for Missouri school districts. And today, Commissioner Van Dieven's here with us today to give us an update on that. So, Margie.
Thank you, Governor. Good afternoon. Just 3 months ago, COVID-19 forced the closure of school buildings. School leaders quickly put plans into place to continue educating and feeding our students in ways never before done, all to protect the health and safety of our students, staff members, and communities as a whole. And I want to again express my gratitude to our school leaders, teachers, and fellow support staff members, as well as Missouri families, for taking care of our kids throughout this time of uncertainty. We're now 2 months out from the start of the coming school year, and students, families, and school staff members continue to think about what the academic year might look like as we continue to face the global pandemic. The situation continues to evolve, and there are still many uncertainties, but here are some things that we do know. There's a great digital divide in our state. While educational opportunities continued to be provided during the school closures, 1 in 5 Missouri students could not take part in those options. That means making any kind of long-term remote learning a real challenge for those students. We also know that families count on our schools for more than just education. Missouri schools have served over 19 million meals to students and families across the state while school buildings have been closed. We also know that hotline calls are down. The Department of Social Services has reported as much as a 50% drop in the number of child abuse and neglect calls that they're receiving. We know our educators and school staff members make many of those difficult calls to further protect the students they care about so much. And we know that schools provide kids much needed social interaction and development. Many have expressed concern about the adverse effect of behavior and mental health on our children that they may have experienced during the disruption to their normal routine and social emotional growth. And finally, we know that schools being open are an important part of our economic recovery. Parents who work outside the home and don't have a way to do their work remotely are left with limited affordable child care options and are often forced not to work. So while building closure was necessary in March, there are a number of serious consequences that can come from our students not attending school in person. These implications are being considered along with the continued risk of COVID-19, and therefore school leaders and local health officials are working thoughtfully to reopen our schools, knowing that school operations must take place differently to better protect public health and combat the spread of the virus. These decisions will be made at the local level, with school leaderships consulting with their local public health officials, as well as with their families, staff members, and communities. Many districts and charter schools across the state have asked their families and staff members what their comfort levels are when it comes to school reopening. From what we know about these survey results, it seems the majority of our families and educators agree they want to be back in school, learning in person, but with extra precautions. So last week, Dr. Williams and our partners at DHSS joined us to host a webinar for both school leaders and local public health officials so we could discuss the various guidance shared about school reopening. Here are some things you can expect to see from your local schools as they reopen. First, we will be communicating to families and school staff members the importance of staying home when you're sick. Now, that's really a paradigm shift for us in education, as we're often accustomed to toughing it out when we're not feeling well. We've encouraged schools to do away with things that are counter to in our shift of thinking, such things as perfect attendance awards or attendance incentive programs. You'll be seeing changes in regards to attendance at the state level as well. In Missouri, student attendance is used in both districts' accountability measures as well as school funding calculations. The State Board of Education will be waiving attendance for Missouri School Improvement Program, the MSIP accountability metric, and we will be working to make sure that we're addressing ways to make payments for school districts for in-seat learning, virtual education, or a combination of both of those methods. Next, you will also hear an increase on the emphasis of good hygiene, screening, social distancing, and masks where appropriate, as they are all layers of protection. These strategies aren't foolproof on their own, and some practices might not be as feasible for certain students or certain schools, but multiple layers of protection help. And third, it will be essential that school leaders and local health officials continue to work closely together. For example, school leaders can help make contact tracing as simple and as efficient as possible for health officials should a positive case occur. This means having organized documentation to account for student and school staff members and their interactions. There are also a number of education-specific issues that our agency is working quickly to address as we look at reopening Missouri schools. We have pulled together a group of educators to form a task force for learning acceleration that is working to develop tools to help schools identify specific gaps in student learning, both academically and in regards to social emotional development. Once identified, targeted supports and appropriate interventions can be provided to get students up to speed upon returning to school. Similar to adults, students may be experiencing this pandemic in different ways. This pandemic has heightened our awareness of the digital divide, and we will continue to focus attention on addressing equitable access to technology and the internet. Education will look different in the future, so educators need more training and professional development to do their jobs differently and provide instruction in this new way. We're proud to be working with a number of celebrated teachers to develop a professional development video series to share the distance learning strategies that worked well for these great educators that they can share with educators across our state. So we look forward to sharing more information about these important questions in the coming weeks. We are all in this together, and we're all stand ready to make the necessary adjustments to continue doing what we have always done, and that is improving lives through education and giving our Missouri students access to opportunities to fulfill their potential. Thank you.
Margie, thank you very much. Thanks for what you're doing at DESE and for the words. You know, I also want to thank the administrators, the teachers across this state for stepping up at a time like we've not seen. You know, instead of complaining and saying things about the way the situation is, the only thing I've known since I've talked to superintendents, the administrators, teachers across this state, the only thing they've did is step forward, realize the situation, are starting to prepare, teaching our kids, and that's been their priority every time I've had the opportunity to talk to them on the phone. I think that with the budget situation, they're doing extremely good job out there meeting the demands of the education, what we're going to go through, and again, making the kids a priority over everything else. So I want to thank them. I want to thank them for understanding the situation. They know, like everybody else in this state, the situation we're in, the way the economy is, and what the budget situation was. So they're doing a good job to move forward, and I appreciate Margie and her leadership and Desi and what they're doing right now to get those kids back in school. As I said Tuesday, workforce development and infrastructure will be a critical part of Missouri's recovery. Before COVID-19, we were making great progress with infrastructure, such as the Rochport Bridge, focuses on our bridge programs across the state, cost share programs across the state. And as we continue to recover, we are excited to get this momentum going again and move forward with critical infrastructure projects across the state. Today, Director McKenna is here to give an update and share some news about a grant MoDOT recently received. Director?
Thank you, Governor. Good afternoon. You know, we are making progress across the state. Our construction industry is responding amazingly well throughout this pandemic, and we're getting good work done. We're having a great construction season so far. The construction industry is implementing social distancing, and they're getting the job done. We have over 400 construction projects going on throughout the state. All good news. But, you know, we're also seeing, in spite of that, and maybe because of it in some cases, we're seeing an increase in traffic fatalities in Missouri's highways. Despite the fact that traffic volumes have been down for the last several months, almost as much as half off of normal times. In 2020, we've seen 402 traffic fatalities, which is an increase of 43 more lives lost compared to the same time last year. Consider this fact, that nearly 70% of those lives lost did not wear a seatbelt. They did not have their seatbelt on, and had they had the seatbelts on, we'd have 100 more of our citizens here with us today. And while it's easy to throw those statistics around, we have to pause and remember that those 100 deaths are people someone knew and loved. Think of the staggering ripple effect those deaths have on the people left behind. You can ask any highway patrol trooper what one of the toughest parts of their job is, and they'll be sure to tell you it's contacting a victim's relatives to tell them of their loved one having been killed in a crash. For 3 straight years, we've seen a decline in traffic fatalities, only to experience this year's unfortunate increase. Just as we see people wearing masks and social distancing, not only for their own protection, but for the health of others, we need a similar commitment from drivers to buckle up their seatbelts, put their phones down, and slow down. This is even more important during this time of the year when we experience the 100 deadliest days of summer, the period between Memorial Day and Labor Day. Summer is also the peak season for highway work zones. We're already seeing a disturbing trend in our work zones this summer, with rampant disregard for speed reductions and lane restrictions, along with general inattention. Just a few weeks ago, 3 MoDOT vehicles were hit in the same week in the St. Louis area. In 2 of the 3 hits, the drivers just took off. We're taking a look at the data across the state to see what additional actions we can take to keep our workers as well as travelers safe in our work zones. One move we're considering is full road closures in areas where we're experiencing high vehicle hits. We know the public doesn't like to be inconvenienced this way, but if that's what it takes to make sure our workers go home alive at the end of their shift, that's what we'll do. On a brighter note, and as mentioned by the governor, I'm happy to report that Missouri is one of just 10 states to receive a discretionary grant from the Federal Highway Administration to implement technologies that will improve mobility and safety for travelers. It's a $1 million grant, and it'll be used for predictive analytics on our I-270 project currently underway in St. Louis. The project will use predictive models that consider several different factors, such as traffic volumes, weather, or special events, to determine the likelihood of crashes and identify response times. We're going to put information in the hands of users to be able to move around those areas. It's really exciting developments. It's being developed in several places across the country, and we're happy to have that on such an important project. I'm also pleased to provide an update on the Governor's Focus on Bridge program. We've placed a total of 114 bridges under contract already. We've completed 13 and currently have 58 under construction. In fact, one will open tomorrow afternoon, the Missouri Route 79 bridge over McLean's Branch in Lincoln County. In total, and mostly prior to the pandemic, this year the Missouri Highways and Transportation Commission authorized over $1 billion in construction awards. That's the first time we've breached $1 billion in awards since 2010. Our construction industry partners, as I mentioned before, are doing a wonderful job maintaining their workforce safety while doing great work on the roadways. We have over 400 active construction projects going on. I also want to briefly touch upon another aspect that's affecting transportation. We are experiencing a drop in transportation revenue as a result of the pandemic. Motor fuel taxes, motor vehicle sales tax, and others, they're off. The department's facing an estimated 30% loss of state transportation funding for a limited period of time. Revenues thus far were off plan by about $45 million, and that's with economic activity through the month of March. We still have April and May to work through, and we anticipate further impacts once we've had all the data. To address the revenue shortfall, the department has slowed discretionary spending on equipment, materials, and supplies since early March. We've slowed new hiring, and we've delayed advertising on approximately $360 million worth of construction projects, which is mostly federal source revenue. We've most recently applied through the Department of Labor and Industrial Relations for the Shared Work Program. The goal of the Shared Work Program is to save jobs by saving payroll dollars through a reduction in employee hours while enabling eligibility for unemployment and CARES Act benefits. Our senior team has taken a pay cut, and the employee work week has been reduced to 32 hours per week. An option was also provided for employees to opt out of shared work with a 5% reduction in pay. We're taking these measures to be able to save state road fund dollars, preserve private sector and public sector jobs, and minimize the financial impact to employees by participating in this shared work program. We anticipate these salary reductions being in effect until September, unless federal action enables modification. I want to thank the entire MoDOT team for keeping the transportation network open during these challenging times and for the sacrifices each of you make to serve the public. For all the travelers on the roadways, please take care in work zones. Observe the speed limits and always, always buckle up and put your phone down. Thank you so much.
Thank you, Patrick, for that update. Thank you for what you're doing at MoDOT and still keeping that construction going out there, and that's important, and trying to make sure all the employees out there are safe. And finishing up today, I just want to say we'll be back next Tuesday. Over the weekend, I want to remind everyone to please continue being safe and proactive. I also want to remind everyone that we continue to hold community testing events throughout Missouri. We have already held community testing in 40 counties across the state, and we'll be holding testing events in another 10 counties over the next couple of weeks. We encourage any who wants to be tested to register through the Department of Health and Senior Services. Any Missouri residents who would like to be tested for COVID-19 can do so at these sites at no cost. You do not have to live in the county or experiencing symptoms. Again, while certain areas may experience outbreaks, this does not mean there has been a second wave. We are now able to aggressively test in these areas and box in the virus. Overall, Missouri is still in a good place. We constantly monitor the data across the state, and our positive rate continues to decline. Missouri is recovering, and we are moving forward. Thank you, and God bless. Kelly will take questions. Dr. Williams also back here today if you have questions for them. Kelly?
Okay. Commissioner Van Dieven? With that extra noise, you may need to speak up a little more. Sure. Okay.
Hey, Commissioner. So one of the big topics of conversation in Columbia has been the school district's decision not to require masking in schools as part of their reopening plan. What's DESE's stance on masking specifically, and what was the thought process behind that?
So I don't know their thought process behind their thinking. We've left that to local decision making because, again, circumstances vary across the state. The age of the child certainly makes a difference. The ability to social distance. There's a lot of factors that go into the mask decision making. So we have left that to the local level.
Is there a set deadline for schools to request a change in start dates?
There is not a set deadline, and to date we have received very few requests to move up the start date. The majority of our schools are still planning to start on August 24th.
Hi, Commissioner. You mentioned that 1 in 5 students weren't able to access virtual learning. So if in the case that schools have to be shut down again in the fall, if there's a resurgence or something like that, what is the department doing right now to continue to address the virtual divide? Yeah,
this is a big issue for us at the department and for the entire state. And I appreciate the governor's support in this. We've had a number of conversations with the governor's office on this concern about access to broadband and services for our children, for our families, because again, just as a reminder, the schools are able to access this typically. We're talking about wanting to get into children's homes, and truly believe that every person in the state of Missouri should be able to access that, and appreciate the governor's support in that work.
2 quick questions for you. First one, is there any sort of thought of possibly making class sizes smaller, or does that once again go back to the local school districts?
Yeah, it'll be a local decision, but there's a lot of thought going into that. When they're trying, that's exactly where our leaders are right now, is trying to think about the best arrangements to make for students in schools. And again, we'll be left to the local district. We could not make that decision at the state level. Classrooms are different sizes. What's happening in each of the regional communities is vastly different. But I can assure you that is a primary topic of discussion for our school leaders right now.
And at this past month's school board meeting from the state, they discussed about virtual learning and how a parent has to, if they do submit that they want their student to learn online, there is no set time, calendar days, that the school district has to respond to them. And I know that that's something that they're going to look again in their August board meeting. Right. What is your thought on that? Is that something that you're implementing just because of this COVID, or something that you're thinking about?
Actually, this part is being implemented because of the new state law that was put into place last year. And there were some components that weren't clearly addressed in the law. And so now that we've had a year to implement it and seen where some of the clarity is needed, we're implementing a rule. And so that's why when you post a rule, you have 30 days for comment. That rule is going to be out for public comment prior to the August meeting. I believe it's going to be posted July the 1st. But you can check our website for the exact date on that, and would welcome people's feedback on that rule. So that's why.
Just going back to the digital divide, have you noticed certain parts of the states that struggle, that the divide's a lot bigger, like in different parts of the state compared to others?
Yeah, and that's the other thing that's really interesting. It comes in there are different reasons as to why that digital divide exists. So it's part of our remote and rural areas. It truly is the broadband expansion that we're looking at, and so you'll see some of that. In some of our urban areas even, the divide exists there as well. And so parts of it are true access to the Wi-Fi itself. Part of it is access to equipment. Part of it is affordability in general. So there's we have a whole big spreadsheet out there again on our website that'll show maps out by county what issue has been identified as the primary concern. But it looks different across the state.
There have had to been some withholds, and the governor announced that the hold harmless agreements are being waived. Mm-hmm. Were there any schools that actually dipped below levels of funding in previous years that were affected by that hold harmless agreement being waived?
Sure. We had a number of districts that are listed. I believe there are about 191 that are considered hold harmless. And, you know, the reality of that is when you're taking something like a withhold that wasn't factored into the actual law when it was written that way, you really have to think about how something like one full payment will impact all districts across the state. So we think it's in the best interest to really divide that evenly across the impact evenly across each district.
And is that waiver connected to the state of emergency?
Yes.
Okay. So is that waiver going into the next fiscal year that starts July 1st?
Yes.
Okay.
All right, thank you, Commissioner.
Thank you.
Director McKenna?
Thank you. Director McKenna, good afternoon. Two questions. If you could talk about the current status of the I-70 Rochport Bridge. I know you briefly mentioned it at the hearing today, but I didn't hear any specifics. What's the status of that? And then you mentioned 13 bridges done, 58 under construction, and one tomorrow will open in Lincoln County. If you talk about the Lincoln County project, and is that the $350 billion bonding plan the governor had a year ago, or what is that specifically?
Well, I wish it was a $350 billion bonding plan. It was $350 million. Yes, that is the governor's focus on bridge plan. We had envisioned about 250 total bridges, and within this is before the fiscal year is concluded. We've already got 114 of those under contract. Our team and our consulting partners have been working very hard. The bridge that's opening tomorrow in Lincoln County, it's just under $1 million, about $890,000 project, and it's replacing a bridge that was built in 1938, and that will be upgraded to current standards. Is going to be 8 feet wider and 20 feet longer. So it's really going to serve the communities that are impacted there very well. It's the perfect type of thing for the governor's focus on bridge program. Projects all across the state are being impacted, being done, and frankly, the legislature and the governor working together to come up with the bonding program means we have the money in the bank. So those projects are going unabated by current economic conditions. So that's a really good, it's a wonderful circumstance to have. With regard to Rochport, we're still in the planning phase of that. The good news, though, is part of that project was climbing lanes for Mineola Hill, and we are underway there. We're making good progress, and we're hoping by the end of the calendar year, we're actually going to have a climbing lane at Mineola Hill. That's the first part of that project. We have substantial additional work on environmental work and engineering before we get to the point of putting out a RFP for construction services on that. We're also looking at the Buck O'Neill Bridge as well. We have delayed the advertising of that. Was originally scheduled for the middle of May, but we actually reduced our own internal time at the department. We haven't impacted the project schedule at all. We think we're going to be out for an RFP for design build by probably August of this year. We'll do an advertisement most likely in July. And so we're proceeding at pace. We have an impediment to that process we're going through right now. We're pushing through, but for the folks in Kansas City, they should know we're not going to have any delays that we anticipate that will keep us from drawing down the build grant. That was a big part of the financing package for that.
Hi, sorry if I missed this earlier, but when you were talking about all of the different accidents and fatalities, do you know like how many of those accidents, the distracted driving, like being on your phone, played a role in that, and of those fatalities, did any distracted driving play a role in that as well?
You know, it's one of the most difficult things for anyone to really put a direct cause and effect on. It's very difficult for law enforcement to have that judgment effect, but anecdotally, I believe that virtually all of them do. We are seeing, and we're getting reports in from our folks in work zones right now, that they rarely see anybody not talking on the phone. It's at a very large proportion, and that is hugely damaging thing, particularly if some of the other behaviors like speeding or other distractions are involved. We do believe that distraction is one of the main causes, even if we can't prove that. It just seems like the work in the last 10 years in a lot of the research that we've seen over the last 10 years shows that we should be seeing a lot faster and a lot better safety reports, particularly because the vehicles are getting so much safer. And we're not. It's counteracted by what we believe is cellular use distraction during that driving activity. We really, we're encouraging our Buckle Up, Phone Down campaign has now spread to about 8 other states. We've gotten word that that NHTSA at a national level is going to be picking this up. They're looking at the possibility of making this a national campaign. We think it's that important.
And with just like cuts to advertising, how are you going to keep getting the message out there about distracted driving?
We work together with a coalition for safety in Missouri. We develop a blueprint for safety. We actually have federal guidance that we have to follow, and some of that safety money that comes from the federal government actually has to be spent on public awareness campaigns. So we're really trying to focus those efforts, use as much awareness as we can. And on the MoDOT website, we encourage everybody to take the challenge. We have a challenge out there to sign up, the Buckle Up, Phone Down Challenge. You know, we have over 500 businesses and over 13,000 people have taken that challenge. It's kind of it's just a pledge to put that phone down and buckle up while you're driving. Thank you.
2 quick questions once again. Any furloughs for any MoDOT workers, and what about their pay? Has it had to be decreased because of the COVID-19 pandemic?
Yeah, we are participating in the shared work program with the Department of Labor and Industrial Relations, and that actually is a department-wide reduction of work hours by 20%, so down to 32-hour work week, and that's also a 20% reduction in pay. But participating in the shared work program actually provides, through the employer, access to unemployment insurance to cover that difference or part of that difference, and access to the CARES Act benefits. Now, we're going to run this for about 12 weeks, and we believe that the vast majority of our employees will see no negative financial impact when they net it out over that 12-week period. The purpose of the program, and the partners over at Department of Labor have been wonderful working with them, as well as the Office of Administration, to help us set this up and go through it. The purpose of the program is to save those jobs. We think there is really good news on the horizon at the national level with regard to transportation investment, and we're going to need all hands on deck to be able to execute that plan.
Yesterday on Twitter, I saw that another MoDOT truck was hit. You talked about 3 happening within the same week just a few weeks ago. Yeah. How many are you up to so far this year or even this month, and is it more than last year?
Yeah, last year was a record. I think we had 38 vehicles hit in work zones last year. I don't have off the top of my head the exact figure for this year. I can get that, but we are seeing it's really distressing, because if you see these truck-mounted attenuators, the TMAs as we call them, they have lights and very bright. They're hard to miss if you're looking ahead of you at all. So it's very distressing when these get hit, and it's dangerous for the traveling public, because somebody striking one of those is absorbing that hit as well. So a very dangerous situation. We're just trying to get the word out for people to pay attention, particularly in those work zones.
Thank you.
You're welcome.
Thank you, Director.
Thank you.
Dr. Williams?
Thank you, Kelly. Just a quick update, if I could. Again, as the governor said, you'll see a statistical thing on the results today. We had 13,000 tests come back all at once from Quest, representing June 21st to June 24th, and about 160 of those were positive. So again, that's not a true day-to-day. As we're in 2 weeks into opening up, we look at our numbers. Our R0 is slightly over 1, which we find very encouraging, remembering that was, I think, 2.8 at the peak back in April. Our positivity rate, as the governor said, remains low. That's about 4%. And so we're very thankful for that, especially compared to other states. That's our 7-day rolling average. Our hospitalizations across the state are at an all-time low. Our ventilatory capacity is, I guess, the best it's ever been. So we're incredibly thankful for all of that. At the same time, we're still very vigilant. I've sent out remdesivir 3 times today to 3 different hospitals that asked for it. So there are patients who are being hospitalized who need that early on in their care, so we're acutely aware of that. We also are still very much focused on Southwest Missouri. I was on the phone with Paige earlier today down in McDonald County, and they're very vigorously doing their contact tracing. Have been in conversations with Tyson Foods and their management as they do their boxed-in testing themselves. The CDC arrived today. Their lead investigator arrived in Joplin this morning, I believe it was, and the rest of his team gets here tomorrow afternoon, so we'll be in conversations with them. And then the National Guard shows up tomorrow and Saturday in those counties to do community testing, as the governor said. Asymptomatic, we're happy to do it. We found that to be very helpful. And so we continue to watch around the state. Kansas City's R0 has creeped up a little bit. Have been in conversations with Rex about that over there. And so Boone County a little bit up. Sent them some remdesivir today. So we remain vigilant and continue to watch around the state. But as we go into the weekend, we're thankful for where we are. Remembering that any case is one too many, but we're thankful that so far we've been able to stay on a trajectory that we find hopeful. Happy to answer any questions.
Hey, Director Williams. The CDC team that you mentioned, is this the first time that an actual CDC team has been called into the state? And if so, why were they called in now?
Yeah, they've been in Arkansas. They've been in Northwest Arkansas doing epidemiological tracing around the food processing plants. And you might remember last Tuesday, we were on a phone call with Arkansas, and they found them very helpful. So we called the CDC, and to my knowledge, this is the first time we've had boots on the ground from the CDC. We talk to them all the time. And so we really were piggybacking on what Arkansas has done. We know that there's some movement across the state in these populations, and so it just made sense. And Nate Smith, my counterpart in Arkansas, thought they were very helpful, so we're very appreciative that they're on the ground. They're mostly doing epidemiological investigation, trying to figure out if there are certain pathways the disease is being spread, and to help us identify those and to try to mitigate. So.
Currently, if you go to the covidactnow.com or .org, excuse me, Missouri is in red. That means critical. How is contract tracing going in the state? Is there enough numbers in the state, enough cases for you to continue doing that?
Well, as far as are there enough? I mean, we're doing contact tracing very much so, especially in Southwest Missouri. We sent contact tracers down to 2 counties. I talked to Paige today. She didn't think they needed any at this time in McDonald County, so we haven't sent any there. It's an integral part of our strategy to do contact tracing, to work, and that's done through our local health departments unless they request our assistance. And so very much a part of our strategy going forward is to layer on the contact tracing to the testing. Once you do the testing and identify people, then you come in and do the heavy lifting of identifying people to either isolate the patient or quarantine their contacts.
Can you kind of quantify how a hotspot becomes identified as one, and what triggers the box-in response?
Yeah, Philip, that's a great question. Well, it's easy for long-term care facilities. One resident or one staff member of our 1,200 long-term care facilities, by rule, has to be reported to us by the facility within 24 hours. And that's also true for prisons and dormitories, for that matter. So that's the trigger for that. Now, when you get to other things that are outbreaks, whether that be a food processing plant or an event or a prison, we look at, we get feedback from the local health departments. I'd say most of the time they alert us and they say, look, we're seeing an increased number of cases down here that we think are a result of this either geographical entity or a living entity or some nidus where we think those cases are from. An outbreak was we had a hairdresser in Springfield that was an outbreak, or at least we worried it was. It turned out not to be. So it's clinical judgment for anything other than long-term care facilities in which institutes our box-in strategy. But we tend to be on the side, since we have such robust testing, if we don't have a definite number, subjectively, we're more likely to go in than we're not.
And Texas today banned elective surgeries again.
Mm-hmm.
That seems like an intermediary between being fully open and fully closed, but it often comes at tremendous cost for hospitals.
Yeah.
What are your thoughts on that? And do we know how effective that was in the spring in preventing cases?
Yeah, again, just incredibly thankful to be in Missouri. As I look at other states, as I said, our hospitalizations for COVID are really at an all-time low. Our ventilatory capacity is excellent. So I'm glad you brought that up, Philip, because that reminds me of something. We really, really encourage people to utilize healthcare now, to go in, and if you need surgery, to have surgery. We're going to release early next week our vaccination rates for, I think it's April and May for children, and they're low. We're going to put out a press release of that on Monday. And that really, and talking with my pediatric colleagues, that's very concerning. So I thank you for that question, because we really want to emphasize that here in Missouri, unlike Texas and some other states, our healthcare system is open to take care of people, and we highly encourage people to take advantage of that. That's a great benefit to where we are in Missouri, that you can go get the healthcare you need.
Hi, Dr. Williams. We had a report of a privately owned health care facility in mid-Missouri that had done some testing and had some positives, but had not reported. And that the state had to step in to help do contact tracing and things like that, because they were alerted by a patient who was never contacted for contact tracing. Yeah. The state, the city health department, the county, rather. Is that unusual, or is that something you're seeing?
No, that's pretty unusual, because as you say that, I'm not sure who that is, and I usually kind of know. It's a state law now that if you have a positive case in your facility, that you, the facility, not the provider's always been required to once they know, but now the facility has to contact us, and then we work with the local health department. So I would say that's really unusual, and obviously we would highly encourage, for the safety of their staff, for the safety of their residents, that there's a reason we do that we feel like this going in and testing everybody has been really helpful. Thank you, Kelly.
Governor Parson.
Let me do one follow-up to Dr. Williams, whoever just asked that last question about that, to make sure, let us know where that was. Was that or something? Because if it's a nursing home, we definitely want to be on top of that extremely well, because like I said, he said state law, but we want to know where those cases are at. We sure don't want that to linger on nursing homes. All right.
Hi, Governor. Even with this statistical kind of anomaly today in cases, we're still seeing record cases in the state. And I know you've been saying it's up to Missourians to protect themselves and protect the community. What would you tell Missourians that may be concerned that we are seeing these more record cases, and they're not seeing people? I've had callers say they're not seeing people social distance and things like that. What would you tell Missourians that may be worried?
I think it goes back. I think, one, you got to avoid that. If you have that concern out there, I mean, you got to stay away from places where there's crowds and stuff. That we all know that. Again, I'm going to go back to social distancing is key. If you're one of those people that says, hey, I don't believe all these people are staying far enough away, then I probably wouldn't be around that. You got to avoid those situations, especially if wherever age bracket you're in, wherever your health condition's in. Again, those basic principles. Look, I don't think you're going to be able to go out there and control that everybody stays 6 feet apart. We can say up here every day and try to recommend it to take whatever safety precautions you need. But again, people are going to have to take that upon themselves, and hopefully you've got the opportunity right now. Don't be in one of those high-risk areas. The other thing we know by doing more and more testing, we know that there's more cases out there. And if I was a young person, as we see these young persons being tested more and more positive, because we're starting to find that out, what we do know is they're probably much more likely to be a carrier that could affect somebody else in some of those high-risk areas than they are themselves, because we know they're probably going to go home and, frankly, get over it, is what they're going to do. Most of them's not going to require hospitalization. But the big concern you have to have is who they come in contact, where do they go, and then who are they affected by that. So again, it's a situation we just got to get through, and we got to make sure we keep using common sense in that, and don't put ourselves in risk if you don't have to.
Yes, good afternoon, Governor. Today, just a few moments ago, Director McKenna mentioned the 402 fatalities, Governor, and he said 70% of them were not wearing their seatbelts. As you know, Missouri does not have a primary seatbelt law. Your colleague, Bill Reibold, who a former Republican lawmaker, tried to pass that. He never could even get a hearing. Is it time to pass a primary seatbelt law in this state?
Yeah, I think it's sure a time to have a discussion on that. When you hear something like that, it's disappointing at the least. You know, I'm going to go back, though, again. We pass laws, legislatures do every year. I've been up here and passed law after law. At the end of the day, you got to put a seatbelt on, and you got to buckle it. And that's going to go back to the people that are driving those vehicles. I sit there and think there's 100 people lost their lives. I don't know what all the circumstances were, all the wrecks, but just because they didn't hook up with seatbelt, you know, and that has to weigh on us all. And even if you had a law in place, the question then is, do you use the seatbelt, you know? But, you know, again, it's a combination of things. But look, I think things should be on the table. Things should be discussion. If you take my grandkids, for example, you know, on the farm, sometimes you get in a farm truck, and I used to not wear a seatbelt all the time when I was on the farm. I was in there. But my grandkids won't even think about getting in a vehicle, and they'll be the first one to tell me to buckle up. So eventually that world that we're going to live in. And make sure when you ask my director about 300 million, you get that million instead of a billion. Don't do that. You know, you got him on cloud nine in here thinking he's got $350 billion to spend now. So, all right.
Crystal? Governor, Kansas City may soon require Kansas Cityans to wear face masks, and there are also other cities that are experiencing surges and talking with their, you know, county commissions and things like that about having maybe a city ordinance or a county-wide order that would require face masks, at least indoors. Would you be supportive of those local ordinances or cities that chose to go that route?
Yeah, I've said all along, it's up to local authorities to do that. Or if they want to require, whether the same way we did Kansas City, St. Louis, Columbia, every city, Springfield, had different requirements of how they had a closure of that, how they opened up. Again, it's up to local levels how to do that, and I've been pretty steady on that throughout this whole process to maintain. So.
And it doesn't matter that it's face masks. It's been controversial in other states.
Yeah, I mean, it's the same. I'm not sure what you mean by the last part of your question, but if the cities want to do that and they want to require that of their citizens that live there, then that's why they have elections in those areas. If people don't like it, they change it. If people like it, they keep the same people in place.
Okay. Thank you. So I know you mentioned you met with the chamber earlier today. They tweeted out a photo around an hour ago about several of the surrounding states having COVID-19 protections for businesses in case there are potential lawsuits. Did you guys discuss that, and what's your stance on that?
Yeah, we have. I've discussed that on several occasions. You know, we talked early on about special session, whether we're going to have that. I'm sure that'll be part of a special session when that day comes. So we're still in the process of discussing those things, but that'd be part of a special session along with some other things. We still got some work to do on the crime bill. One of the things that was very disappointing last year, one of the major issues that the cities, the mayors, the police officers, the African-American community, the clergy, you know, some of the things when it comes to the witness protection plans didn't get done last year. That was a big issue. That really addresses violent crime more than anything else. And you know, if we have a special session, I'm sure we'll be discussing issues like that they're very important, that can have an immediate impact.
We'll take one more question, Governor Parson, right here, ma'am.
Governor, going off topic of COVID real quick, earlier today, Kansas City's mayor introduced an ordinance to include a ballot question on local control of Kansas City Police Department on the November election ballot. What are your thoughts on local governments maybe doing the same thing, or even for Kansas City? Yeah, what they'll have to do, it's a legislative issue whether they change the law here on that or not. I'm not sure what Kansas City, I'm not sure what he voted on or what they voted on in the city council, but I mean, it's fine for them to decide that, but the legislatures will have to make that change also to be able to do that. I know there's a couple other questions. You want to take a couple more? I'll take a couple more.
Thank you, sir. Representative Hicks has offered a bill, is filing a bill to deal with what he calls police abuse of force. Are you open at all to including police review or reform in a special session?
You know, we haven't talked about that at this point. I think we all see that there's going to be review of policy. I think we're all discussing that, and I've discussed that with public safety. I know the cities are. I'm not sure that would be a special session just for that, but I'm not saying it wouldn't either. You know, I don't know. I think, again, as we try to talk about reform, you know, and you've all heard me say that I'm very supportive of the law enforcement community in this state, for those officers that go out there every day, and for the ones that do it right, day in and day out. I don't have any people that don't do it right, law enforcement officers that don't conduct themselves professionally, then I don't have any mercy for them. They need to be held accountable for that. But again, I think you're talking a process that's going to take some time to see what that is, see what changes we're talking about making. You know, it's one thing to talk about a chokehold, and I get that. I'm making changes of whether you put pressure on somebody at the back of the neck. Yeah, we shouldn't be doing that. That's quite evident that we shouldn't be doing that. But then what else does that mean when you say that? And I don't know what all that bill would look like. I don't know what all would be put in it. And I don't know that you can get it done in a special session. I would look at things like that to look at to say, if you have a special session, what are you really going to narrowly focus on to get done? And I think something like that probably is more apt to be in the legislative session, where you have public hearings, where you have time to go through that and really analyze that. But I think there's going to be discussions on that in the legislature this year. I think there'll be an opportunity to see that. All right, one more.
Governor, you mentioned a special session. Are you considering, you know, if you were to have one, considering a special session before the veto session, or would that run concurrently?
Yeah, I mean, those are all options that are on the table. I mean, we've talked back in May and June about a special session, just seeing when that would happen. You know, I got to look at cost availability. What's it cost to get people in here? How long is it going to run? What are we going to put in the call? A lot of things like that. So we haven't decided on a time on it yet, but we're definitely, I'm sure there'll be a special session without a doubt between now and the first year.
Okay.
All right. Thanks, everybody. Thank you.